Cholesterol is a fatty substance or lipid that we need as a raw material for making important things we require to keep our bodies healthy. Most of the cholesterol we need, actually we make ourselves, about 80% or more. And that then has to be distributed to where it's needed around the body through the bloodstream. Most people will not have had a cholesterol test, and they will only have been invited to have one with their GP when they show up for an MOT as part of an.
There are a number of different types of cholesterol, and when you measure a total cholesterol, that is a combined sum of your LDL, which is your bad or lousy cholesterol, and then your HDL, which is your heart-healthy cholesterol. And it also has an amount for triglycerides, which are another way that your body kind of transports fat around. So your good cholesterol is your HDL, and that seems to reduce your risk of heart disease. Kind of goes up and cleans out your arteries a little bit, or picks up some of the problems that can occur from your bad cholesterol, which is your LDL.
And what is the normal range for cholesterol? The normal range is generally based on the higher limit of normal. Total cholesterol levels of over 200 are considered high. The cholesterol is also broken down into what is generally referred to as good cholesterol and bad cholesterol. Good cholesterol is high-density lipoprotein, or HDL, and bad cholesterol is low-density lipoprotein, which is LDL. There's also a component of the cholesterol called triglycerides, which are the fat level in the blood. The triglyceride level of less than 150 is considered normal. A HDL level of greater than 40 is considered normal, and an LDL level of less than 130 is considered normal. There is a range between 130 and 160 of LDL, which is considered borderline.
Statin drugs block an enzyme in our liver that helps to produce cholesterol. So when it blocks that enzyme, it lowers our cholesterol levels.
That's important because cholesterol builds as plaque in the artery walls, constricting the blood flow to the heart, and that can lead to an attack or stroke. So statins can be a crucial medication. But as with many medications, there can be severe side effects for some.
The most common side effect that we would worry about in statins would be harm to your liver. So statins are metabolized in the liver, and so after you start a statin drug, your physician will recheck your liver enzymes in about 6 to 8 weeks. The other most common side effect that we hear about from patients are muscle aches and pains. And so when your physician also checks your liver enzymes, they may also be checking some enzymes that can tell us about muscle breakdown or any muscle damage. If your doctor sees that your liver enzymes are elevated beyond a certain threshold, or if there's any suggestion that you may have some muscle damage, we will likely stop your statin therapy.
There have not been any new cholesterol-lowering medications that seemed as promising as statins until now. A new class of cholesterol drugs without those dangerous side effects.
PCSK9 inhibitors are different than statins because they work in a different pathway in the liver to help prevent those high cholesterol levels. And they block this enzyme, PCSK9, and that is very important to your liver in producing cholesterol. So when you block that enzyme, your amount of cholesterol that you have goes significantly down.
How are you feeling? Any chest pain, any pressure, shortness of breath?
No. Although doctors like the new drug, there are some drawbacks.
PCSK9 inhibitors are incredibly expensive, and they're also an injection drug, and you'd have to come into the doctor's office twice a month, learn how to use them, and then you can do them at home. But it seems to be a much more involved process, and the cost oftentimes can also be prohibitive.
Right now, they're more expensive than statins, and since they've not been on the market that long, there could be some unknown long-term side effects. There are other options, like bile acid sequestrants, which redirect cholesterol to be used to make bile acids in the gut, and cholesterol absorption inhibitors, which limit the amount of dietary cholesterol that can be absorbed into the bloodstream. Because their effects have not been as strong, they've mainly been used alongside statin therapy. But doctors are hopeful.
I suspect there will be new drugs coming down the pipe just because we've had great success with PCSK9 inhibitors, and I suspect there will be other drugs that are coming soon to help patients that do have high cholesterol to give us another alternative to statin drugs.
Holly Furfer, CNN, Atlanta.
Step 1. Use exercise to naturally disrupt the metabolism of fat. Eating less helps, but excess body fat will keep cholesterol up until you actually lose pounds by breaking a sweat. Moderate walking and workouts 5 days a week can raise good cholesterol by 10%. The National Heart, Lung, and Blood Institute of the National Institutes of Health suggests everyone 20 and over should check their levels of bad cholesterol every 5 years. Step 2. Relax and reflect periodically, rather than give in to the high tension that constricts arteries and raises blood pressure. If you're constantly stressing out, consider making some long-term changes that will eliminate some of your stress for good. Step 3. Drink green tea, full of compounds that can lower bad cholesterol. Eat leafy greens as well for soluble fiber that sponges up cholesterol in the digestive tract. Step 4. Consume nuts instead of cheese, meat, or croutons in salads. According to the Food and Drug Administration, a daily handful of 42.5 grams of nuts may reduce cholesterol and the risk of heart disease. Step 5. Substitute meat with fish twice or 3 times weekly. Consuming fish can profoundly lower cholesterol and triglycerides. Step 6. Select smart fats for your diet, substituting canola or olive oils for vegetable oil, butter, margarine, lard, or shortening. It's not merely fats, but the kind of fats you eat that make the difference. Eggs do not drastically increase cholesterol. Step 7. Take a cholesterol-lowering drug if you have evident cardiovascular risks. Beforehand, consider alternatives like niacin, bile acid resins, and fibrates. Step 8. Resolve to make changes and live a healthy lifestyle. It's your life. Only you can make the changes to lower your bad cholesterol.
Namaskar. Today we are going to speak about cholesterol. Cholesterol is found in every cell of the body and is very important for the body function. It's manufactured by the body and taken from the food. However, high cholesterol is not good for the body, and it's the main reason behind heart attack. Our body needs the good cholesterol, which is HDL, and should also avoid building up the LDL, which is the bad cholesterol. In order to control the bad cholesterol in the body, we can do pranayams, which is the Kapalbhati and the Ardh Kapalbhati pranayam. Our expert shows you how we do the Ardh Kapalbhati, wherein we lock our nostril, inhale, and then exhale with a force while contracting our belly or the stomach. Similarly, we can do the simple Kapalbhati without locking our nostrils. You can do Kapalbhati and the Ardh Kapalbhati between 400 to 1000 repetitions every day in order to get relief and maintain the cholesterol levels in the body. Thank you for watching this video. Namaskar.